Has someone you love started showing subtle but concerning changes over the past year? Maybe their energy isn't the same, or you've noticed their appetite dwindle, or their memory slip in new ways. It's easy to tell yourself it's just normal aging, or that these things don't mean much. But here's something most people don't realize. Many deaths in old age don't happen suddenly. The body often sends quiet, almost hidden warnings, months, or even a year, before life reaches its final stage. The problem is, those signs are so subtle at first, they're often ignored. Families miss the gentle signals. It's only later, looking back, that they realize the clues were there all along, pointing to what was coming. But by then, it's too late. Too late to prepare, too late to make arrangements, and most importantly, too late to savor the precious time that still remained. That's why this conversation is so important. Today, we're going to talk about 5 key signs that the human body often shows in the year leading up to an elderly person's passing. Some of these might sound familiar changes you've observed, but brushed off as just getting older. Others might surprise you, but recognizing these signs early can make an enormous difference not only for your loved one's comfort, but for your emotional and practical readiness. When you know what to look for, you're not caught off guard. You can act with clarity, provide the care they truly need, and most importantly, make the most of the time you've been given with them. This isn't just about knowing what's happening. This is about cherishing what matters most in the time that remains. So, stay with us to the end, because understanding these 5 signs won't just help ease the journey for your loved one, but for your family as a whole. Before we dive in, make sure to subscribe to Elderly Doctor. Hit that like button, share this with your friends, and turn on the notification bell so you never miss an update. Your support means the world to us. Let's begin. Now, let's begin. Sign 1. Significant weight loss. One of the earliest and most significant signs that someone may be entering their final year of life is unintentional weight loss. At first, it might seem small. Maybe their belt needs adjusting, or their favorite sweater starts to hang loosely on their frame. Perhaps you notice they just don't seem to eat as much anymore. For many families, this is dismissed as just aging. But weight loss, especially in seniors, is rarely just an innocent change. Weight loss can mean many things, but when it happens without trying, it's a critical signal. It often indicates that the body is no longer absorbing nutrients the way it used to. Muscle starts to vanish faster than expected. Energy levels drop, making even daily movements feel harder. And over time, this sets off a domino effect, making the person weaker, more prone to falls, and vulnerable to infections and other health complications. Sometimes, subtle appetite changes can explain the weight loss. Food just doesn't appeal to them the way it used to. They may leave meals half-eaten or avoid their favorite dishes altogether. This isn't about being picky or stubborn. It's actually the body slowing down. It may no longer send hunger signals as frequently, or it may struggle to digest food efficiently. Then there are illnesses. Weight loss is a symptom of many chronic diseases that affect seniors, like cancer, heart failure, or kidney decline. And even depression or early stages of cognitive decline can sap their motivation to eat, leading to malnourishment over time. Families often try to solve this by encouraging them to eat more, adding protein shakes or snacks to their daily routine. But if the weight loss continues despite this, it's important to accept that something deeper is happening. This isn't just about trying to bulk them up again. It's the body signaling the beginning of a gradual shutdown. Instead of forcing large meals, think smaller and simpler. Offer soft, easy-to-eat foods they enjoy. Focus on hydration too, because staying hydrated matters just as much as food for their comfort and well-being. Recognizing weight loss as a key sign is the first step toward preparing emotionally, practically, and logistically for the road ahead. It allows you to shift from trying to fix it to creating an environment of care, comfort, and understanding. Sign 2. Extreme fatigue and weakness. The second sign is deep and persistent fatigue, the kind that no amount of rest seems to relieve. This isn't the occasional tiredness we all feel after a busy day. It's a heavy, unshakable exhaustion that makes even the smallest tasks feel monumental. Simple activities like sitting up, walking across a room, or dressing themselves become overwhelming. Suddenly, things they've done their entire lives, making a cup of tea, folding laundry, or even holding a conversation, leave them drained. What's happening here is more than just aging. Their body is slowing down at a deeper level. Organs aren't functioning at full capacity. The heart struggles to pump efficiently, muscle strength dwindles, and oxygen doesn't circulate as easily. As a result, the body instinctively conserves energy, prioritizing only the most essential functions. That's why your loved one might start sleeping more during the day or taking longer naps. What's especially difficult about this stage is how it affects them emotionally. Imagine being someone who's been independent all their life and suddenly finding it hard to even get out of bed. For many seniors, this deep fatigue brings frustration, sadness, or even embarrassment. They may withdraw, avoiding activities they used to love because they simply don't have the energy anymore. As a family member, seeing this happen is heartbreaking. But it's important to remember, this isn't laziness, and it isn't about pushing through. What they need most is for you to understand where they are. Let them rest when they need to. Adjust your expectations. Spend quiet moments together that don't require effort on their part. These moments can still carry deep meaning. Sign 3. Cognitive confusion or emotional withdrawal. As someone approaches the final stages of life, changes in how they think, communicate, and interact with others become more apparent. This may show up as forgetfulness, confusion, or difficulty following conversations. You might notice a loved one repeating the same questions, losing track of time, or forgetting people and places they've known for years. This isn't just everyday forgetfulness that comes with aging. It often signals that the brain, just like the rest of the body, is struggling with reduced oxygen and blood flow. Cognitive changes happen because the body is prioritizing vital functions and gradually redirecting energy away from non-essential systems, including memory and cognition. Sometimes, these lapses can feel inconsistent. There may be moments of lucidity where they seem almost like their old self, followed by episodes of confusion or disorientation. This inconsistency can be emotionally difficult for families to navigate, especially when a loved one seems distant or not themselves. Emotional withdrawal is another key sign to watch for. Someone preparing for the body's final transitions often loses interest in social activities, conversations, or hobbies. This isn't because they've stopped caring. For many, even the mental energy required to engage can feel exhausting. Conversations can become overwhelming. Environments that once brought comfort, like lively family gatherings or group activities, can feel overstimulating. They may spend more time sitting quietly in their favorite spot or become increasingly detached from the world around them. You may notice they speak less, interact less, or ask to be left alone. For families, this is one of the most emotionally challenging signs. It can feel like you're losing your loved one long before they're physically gone. Mood changes are also common, such as irritability, anxiety, or uncharacteristic calmness. These shifts are not entirely under their control. As circulation slows and neural connections weaken, the brain struggles to process emotions as it once did. If you've noticed confusion, forgetfulness, or withdrawal in your loved one, try not to fight against it. Instead, meet them where they are. Avoid overwhelming them with questions or frustration if they forget something or seem withdrawn. Instead, create a calm, familiar environment. Sit with them in silence if that's what they prefer. Speak to them gently, even if they don't always respond. Even when words fail, your presence speaks volumes. This is the time to focus on creating moments of peace and reassurance. Remember that even small acts of kindness, like holding their hand or sitting beside them quietly, can still bring comfort in ways words cannot. Sign 4. Frequent illnesses and slow healing. Another sign to look for is a noticeable decline in your loved one's ability to fight illnesses and recover from minor injuries. You may notice they're catching colds more frequently, experiencing recurring health issues like urinary tract infections, or taking much longer to heal from small cuts and bruises. This happens because, as the body enters its later stages, the immune system grows significantly weaker. Fighting off bacteria and viruses that were once harmless becomes a challenge. Even antibiotics or other treatments that once worked quickly may seem less effective. The result is longer recovery periods or a pattern of repeated illness. Cuts, sores, or scratches that don't heal properly or appear to worsen over time may indicate poor circulation. Without proper blood flow to the skin and surrounding tissues, the body struggles to deliver the oxygen and nutrients necessary for healing. You might also notice bruising that develops unexpectedly or grows more prominent as the blood vessels under the skin become fragile. Illnesses like pneumonia, urinary tract infections, and skin irritations are particularly common in the year leading up to a person's passing. Pneumonia, in particular, becomes more likely as the lungs weaken and the immune system can no longer protect against ordinary respiratory infections. One unique challenge with elderly individuals is how infections present themselves. Instead of high fevers or obvious symptoms, seniors may show subtler signs like confusion, drowsiness, or a sudden decline in alertness. Families might not realize an infection is occurring because the warning signals are less dramatic than what we typically expect. What can you do during this time? First, prioritize comfort and prevention. Keep your loved one hydrated. Help them maintain hygiene and monitor for signs of illness. Maintaining skin health by gently moisturizing, cleaning minor wounds, and repositioning them if they're less mobile can reduce the risk of infections and pressure sores. If infections do occur, and they will, it's important to weigh treatment options carefully. In some cases, aggressive medical interventions may not significantly improve the situation and can actually cause unnecessary stress. Instead, many families choose to focus on comfort, keeping their loved one calm, clean, and as pain-free as possible. Repeated illnesses and slow healing are a clear sign that the body's systems are winding down. Rather than seeing these as problems to solve, view them as signals to shift your priorities. It's a time to focus on quality of life, not endless treatments. Sign 5. Changes in breathing and circulation. The final sign we'll discuss concerns some of the most visible and sometimes distressing changes that can occur as life enters its final stages. Breathing and circulation. You may notice your loved one breathing more shallowly or irregularly than before. Sometimes the breathing slows dramatically, followed by brief pauses. This is known as Cheyne-Stokes respiration, where the breath alternates between deep, rapid cycles and long, quiet pauses. These changes can be subtle at first, but over time, they often become more pronounced. Circulation also begins to weaken. This is why you might notice hands, feet, or even the tip of their nose becoming colder to the touch. The skin might take on a pale, bluish, or mottled appearance, particularly in the fingers and toes. These changes are signs that good circulation is now being reserved primarily for essential organs, as the body conserves energy. Shortness of breath becomes more common, even during simple activities like speaking or sitting up. Some may start breathing through their mouth more to compensate, or they might use pillows or recliners to stay propped up because lying flat feels too restricting. In some cases, fluid begins to build up in the lungs, making it harder for them to take full breaths or causing a raspy, gurgling sound in their breathing. Families often mistake this as congestion from a cold, but it's typically part of the body's natural process of slowing down. These changes can feel unsettling to witness, but they're often well managed with supportive measures. Keeping the room quiet, cool, and calm can ease the effort on their breathing. Offer water in small sips if they can still drink, and consider using a humidifier to keep the air moist. Instead of seeing these changes as needing urgent intervention, view them as opportunities to provide gentle care and reassure your loved one. Speak softly, hold their hand, and let them know they're safe. Recognizing these 5 signs: weight loss, profound fatigue, cognitive decline, frequent infections, and changes in breathing may feel overwhelming at first. But understanding what's happening allows you to shift your focus from fighting against the inevitable to embracing the moments that truly matter. A loved one nearing the end of life doesn't just need medical care. They need compassion, understanding, and the unwavering presence of those who care about them. They need dignity, they need comfort, and they need to know they're not alone. So if you're noticing these changes, take heart. Know that this is a time to hold on to the moments that matter most, to let go of what you can't control, and to focus on love above all else. Even as the body slows, the bonds we share remain unbreakable. Thank you for watching, for caring, and for being present during this most meaningful time. If you found this video helpful, share it with others who might benefit. Consider leaving a comment below about what you've learned or how you'll carry these insights forward. Supporting one another through these experiences makes the journey easier, lighter, and filled with love. We'll see you in the next video. Until then, take care of yourself and your loved ones.